So we have this little boy in for his vaccine. Today we're going to show you how we give a vaccine in a fear-free way. So whenever you give a booster vaccine to pups or dogs, it's a really good idea to give a good clinical examination. We've done this already, but in general, you know, in puppies, check their teeth and their bite. So he has a good bite. Open their mouth and make sure there's no cleft palate or anything there abnormal. Check their eyes, no discharge. Oh, you're wagging your tail at me. Their ears, puppies can be prone to having little ear mites, so his ears are nice and clear. Just his lymph nodes under his neck. The other thing then is always check their heart as well to make sure there's no murmurs going on in their heart. The other thing with puppies is to make sure that they have 2 testicles at that time, so that you can record if there's only one down yet. So he has his 2 there, all good. And also check their temperature as well before giving a vaccine. So we've already done this with this little fella. So the main thing today is how to give a vaccine in a fear-free way. So step 1, I guess, is to make sure that you don't just come along and stick the vaccine in really quick to the dog and wait for the screens. I like to take the vaccine out of the fridge to let it come to room temperature before the vaccination. So we've done that here today. The second thing is to desensitize them a little bit. So, you know, this is where the vaccine's going to go. So do it a few times, you know, lift up the skin, give them a little thing like that. So you're not just going to come in and go straight in with vaccine. The other thing is when you're given the vaccination, don't just get the end of the syringe and in as quick as you can. It's like a power hose. If you do it in really quick, you're going to spread it really, really far. So when you lift the skin, inject nice and slowly in so that the actual liquid doesn't spread that far under the skin. So we have it all drawn up here, ready to go. So this boy's been vaccinated for distemper, hepatitis, parvo and lepto today. So the other thing to do is needles. Please don't spare your needles. So we've drawn up now with this needle. So we're going to take that needle off and we're going to put on a fresh needle. Always use the smallest gauge that you can. I'm using a 23 gauge here. So if you want, then get your tasty treat and we'll distract Puppy now with his treat. We'll put a little bit on the table for him. Do you like treats? Oh, we're sliding around the place. Now, do you want some treat? So distract them with a nice treat, which he has no interest in. Is that yummy? Oh, yummy. Do you want some more? So while they're licking that, if you have someone to just distract them for those few minutes. So like I was saying, don't just go straight in, give a few little things like that, in with your needle, and nice and gently, slowly in then with the liquid. So that's him done, he didn't even notice. And the important thing afterwards is to give them a good treat afterwards to make the whole experience good so that all he remembers is the nice things afterwards. He was absolutely brilliant. So the main things are vaccines out of the fridge to bring them up to room temperature. Change your needle, so don't be greedy with your needles. Use one needle to draw it up and then put a new needle on to inject. Desensitize, so touching them up in this area beforehand and slowly injecting in underneath the skin then so that we don't spread it really, really far like a power hose. And that's the treats. Good boy, he was really good. Now, good boy, you're the best.